health data. Next slide, please. So, massive data collected, they are stored and superficially analyzed. I have seen volumes of data very superficially analyzed. Actually, even this data can be analyzed. I believe that they are not analyzed because it will actually show up that health and caste are related, health and poverty are related, things which we don't want to actually show up in public. So this data which is collected is not employed to correct the system, not employed to target specific vulnerable groups which they should be doing. There is a huge issue that the data generated by the National Rural Health Mission and many of the government programs are not used at point of delivery. So if some data is generated and not used at the sub-center or the district level and sent to Delhi, then much of this data may not be accurate. I do not want to say that there is lots of instances of fabrication, but much of this data is not accurate because they are not being used at the point of delivery and sent to Delhi. So हाँ वहाँ भेज देंगे तो उनको क्या मालूम होगा कि ये ठीक है या नहीं है. So this is a huge issue. Lots of incorrect data has been coming in. Next slide. Which I think the ministry also is aware. So it's not that they are not aware. Now, this NRHM is a project. Whenever the state government feels this is a central government project, so there is no integration between the already existing state government system and the central government NRHM scheme. The state governments are supposed to produce 15% of the NRHM, add 15% to the NRHM budget. This rarely happens. Most of the time, it's only the central funds which are being used. The question is it because there is a lack of priority on health from the state governments, or I don't quite understand the taxation and funding. Do they really have money to put in that 15%? Will they have money to take over the NRHM when this project ends, maybe in 2017 or whenever? So what is happening in the state is that the NRHM is treated as a project. There is a parallel state health service. The NRHM initiatives supposedly to be integrated are not actually integrated. So what happens is the NRHM is a set of buildings, equipment, doctors, but not a fully functioning health system at the state and district level. Next slide. So we have direct competition between the NRHM platforms and the state platforms. The village health and nutrition days compete with the ICDS nutrition schemes, the Anganwadis compete with the ANMs, the mobile clinics with the sub-centers. So many, for example, Andhra Pradesh have a mobile clinic scheme which is very popular with the people, but the sub-centers are being run down because of this competition. Next slide, please. Then we have the issue of procurement of supplies. The Tamil Nadu government has set up this medical supplies corporation, and I believe there are 12 states which have followed suit for centralized sourcing, for reduction in cost and controlling quality. But there's a huge resistance in many states to this, both from the doctor side, from the middlemen side, and I presume from the